on Tuesday. And those are some of the headlines. This is Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman.
And I'm Juan Gonzalez. Welcome to all of our listeners and viewers around the country and around the world. As Republicans try again to block the implementation of Obamacare, the major part of the Affordable Care Act is about to take effect. Individuals seeking health insurance under Obamacare will be able to enroll online through new federal marketplaces beginning Tuesday, October 1. The marketplaces are primarily designed to serve the 48 million Americans without health insurance and those who buy insurance on their own. Earlier this week, the White House unveiled new figures showing most health care premiums will cost less than previously projected. The average mid-tier plan will cost $328 a month, with most qualifying for government subsidies to lower that price. Meanwhile, on Capitol Hill, Republican Senator Ted Cruz of Texas held a quasi-filibuster against what has come to be known as Obamacare.
And anyone who is trying to make this a battle of personalities is trying to change the topic from the topic that should matter. Whether or not Obamacare is helping the American people. Mr. President, if you focus on the substance, the evidence overwhelming. This law is a train wreck.
On Thursday, President Obama mocked his Republican opponents and vowed to stop attempts to get the program bogged down in an ongoing budget stalemate.
Now, of course, the closer we've gotten to this date, the more irresponsible folks who are opposed to this law have become. Some of the same Republicans who warned 3 years ago that this law would be Armageddon. That's what they said, Armageddon. Now they're threatening steps that actually would badly hurt our entire economy. Not because of the Affordable Care Act, but because of what they're threatening to do. Some have threatened the government shutdown if they can't shut down this law. Others have actually threatened an economic shutdown by refusing to pay America's bills if they can't delay the law. That's not going to happen as long as I'm president.
Under the new health care law, everyone must be enrolled in a health insurance plan or pay a penalty by next year. With the opening day for the health exchanges less than a week away, many people still have questions about how the program will work.
Here in New York, people looking for health insurance will be able to turn to a network of agencies around the state to help them enroll. One of the partner organizations is the Community Service Society of New York. To walk us through what will happen here and throughout the country, we're joined by its Vice President of Health Initiatives, Elizabeth Benjamin. Welcome to Democracy Now!, Elizabeth. You've been qualified as one of thousands of navigators throughout the country who are officially empowered to help people. So what happens on Tuesday, October 1st?
Sure. What happens on Tuesday is the state-based exchanges and the federally facilitated exchanges, or what we now call marketplaces, will be open for business. That means there will be these websites, essentially. There's one giant one for the entire country. It's at www.healthcare.gov. Will be open, and people will be able to put in some basic information about themselves and who lives with them, and set up a little account, a little username and an ID. Then they'll put in information about themselves, their family. They'll indicate if they have a Social Security number or not. They'll put that in. They'll put how much their income is roughly, and then they'll be processed and determined whether they're eligible for financial aid to buy health insurance. And then once they decide if they're eligible for financial aid to buy health insurance, then they can select between the different plan options that are out there. So basically, people will be able to start shopping for health insurance in a way that does apples-to-apples comparison.
And now you mentioned in the state exchanges and the federal exchanges. Could you explain the difference, where the states are running them as opposed to the federal government, and why?
Sure. There's 17 states that have decided to move forward with the implementation of the Affordable Care Act. There's 7 states that are sort of halfway implementing it, and another 27 that are just saying, we don't want anything to do with this. We're just going to let the federal government come in and run the marketplace for our state. No matter where you you are, you will be able to get a wide selection of insurance carriers, and you will be qualified for financial aid. In New York, 3/4 of the people who go to the marketplace will be eligible for some kind of financial aid to purchase commercial health insurance.
So here you are, you go on this website, and you just said, and once you put in all your information, you then choose the insurance you want. I mean, that sounds, to say the least, extremely daunting. How on earth, I mean, first of all, how many choices do people have in New York and all over the country? And how on earth can you figure out what you want? Well,
the amazing thing is it won't be daunting anymore. It's exactly the opposite. Right now, if you're a small business and you wanted to shop for health insurance on the open market in New York State, you'd have a choice of 15,600 products. That's overwhelming. That's complicated. When you go to the marketplace, you'll be able to put in your information. It will give you a very small, it will give you a selection of plans. You will have choices, but the choices will be standardized. You will be able to do a real comparison. You will know exactly how, for example, Aetna compares with Empire or Blue Cross Blue Shield. So for the first time, purchasing insurance will be on a level playing field, which is remarkable for consumers. So it's almost the opposite. It's simpler now.
Elizabeth, now you mentioned small businesses. There have been some, obviously, kinks in the rollout of the program, and some information that, for instance, Spanish language information will not be available yet for several weeks, and also there aren't information on small businesses. Has that been delayed as well, or is that?
No. What's really great for small businesses, there was never a mandate. There was never a stick or requirement for a small business, and a small business is actually quite large. It's less than 50 employees, and that's common law employees, so you could have 80 employees, half of them are half-time or whatever. You'd still qualify as a small business. There's no mandate. There's no stick or requirement for them to offer coverage to their employees. What there is, however, is this incredible opportunity of 50% tax credit. That means, for example, say we have Bob, who owns a body shop, right? He has 7 employees that make $24,000 a year. He lives in Queens. He has this body shop. He's not paying very much money, but his workers are low wage. He can have the federal government pay 50% of the $16,000 insurance tab for that small business. So 50%, $8,000, just the federal government will write. That's a big carrot. And the rest of it, the other $8,000, he can deduct from any income taxes he has or profit taxes that his business has. So it's an extraordinary incentive for small business. So if you are someone that has 2 or more employees, I really encourage you to go what they're called small business or marketplaces, or shop exchanges is sometimes the other words that we use for them. There'll be one at the federal level, but there's also one in a lot of the states that are moving forward, and shop through there. What has been delayed was the mandate on large employers to either offer coverage or pay a penalty. Now, that's not so important for the simple reason that 95% of all large employers already are offering coverage. And most large employers offer coverage. Why? Because that's how you retain good employees. So we don't really think the delay of the mandates that significant of an issue. What's really exciting is that there's incredible incentives for small businesses.
Well, also, the issue of you mentioning large businesses that already supply insurance. Are there provisions for tax credits for employees who are receiving health insurance but maybe their premiums that they're being offered are too high?
Exactly.
Not just the 48 million who are uninsured, but actually people who are currently insured.
Right. Some employers do offer coverage, but it's extremely the employee portion, what comes out of your check every 2 weeks, is extremely expensive. If that insurance is over 9.5% of your gross income, of your gross wages, you can then say, forget it, I'm not taking my employer's offer of coverage, my job-based insurance. I'm going to go into this marketplace and get a big old tax credit or financial aid and get insurance through the marketplace. So that's super good. Yeah.
And this issue of the Associated Press reporting that the Spanish language version of the healthcare gov site will not be ready for several weeks.
I believe it will be shortly. I mean, it takes a lot. It's a big project. They're working as hard as they can. The best IT minds in the country are working both on the federal exchange and here in New York, and I think it'll be bilingual shortly.
And if you don't have access to a computer, what do you do?
Well, that's where people like me come in. So what we are called certified, we're navigators, and we are certified. In New York State, we've been through a very comprehensive 3-day training. We are the place you can go for absolutely neutral, independent assistance enrolling into this marketplace. So you can come to me, I can sit with you with a laptop, I can go to your home, I can sit down with you and walk you through the process, explain.
You personally or your organization?
I'm certified. But my organization, we have, I think, 10 of us already certified, and we have a network of, 40 other groups, 17 of which are chambers of commerce around the state of New York, who are certified to help either small employers or individuals go through this process. What's great about these navigators, and we're all over the country, every single state has them, is that we're absolutely neutral. We are not on commission from an insurance company. We have no opinions about whether one insurance company is better than another. We're just going to help you through the enrollment process. We're going to figure out which insurance companies offer your hospitals, your doctors, how they we can tell you how they rate on the quality ratings for like how they do on outcomes for various things, like do they vaccinate their kids by 100% of the kids that are enrolled in that company by age, whatever it is, 2, 5. They keep having more vaccines on my kids. But anyway, so, that's what we can do. But we're paid by grants from the government. We're not on a commission from an insurance company. And that's very important.
You mentioned that there are navigators all around the country. Some states have made the certification and the availability of these navigators extremely difficult. Georgia, for example, or Florida. Could you talk about the difference in how states are dealing with the question?
How people find these navigators.
Either finding them or licensing them. Yes.
Well, we're all licensed either by a federal government through that training, or in New York we do it through a state-based training. We all go through rigorous training, at least 3 days here in New York. There's in-service training that will be going on all along. And people find them by going to healthcare.gov. You just type in, I want an in-person assistance, and this is my state. If you go and type in New York, it'll flip you over to the New York State of Health Marketplace, and then every county has a pop-up. In my organization's in, I believe, 61 out of 62 counties in New York State. There's one county we couldn't find a partner in, but they have great navigators in that county. So we're everywhere in New York, and there's a lot of them all over the country.
And what's the number of Community Service Society? And also, are navigators taking calls now, or is it October 1st?
Oh, we're booking appointments now. I mean, I want 25 people into CSS on Tuesday. So our number is 888-614-5400, or you can just email us at enroll@cssny.org.
We're going to break, and then we're going to come back to this discussion. We want to ask you about some of the people who have come forward now to ask for health care, for insurance, and how you're going about dealing with them. Elizabeth Benjamin, Vice President of Health Initiatives at a Community Service Society here in New York, and she is one of the thousands of navigators who have been trained all over the country to help people navigate the system that begins on October 1st in states around the country. Stay with us.